Alright, I'm Katelyn Bennett, and I'm going to talk about the control of strangles, also known as Streptococcus equi, through isolation. So, in today's world, horses are coming and going into different barns, going to horse shows, going to horse sales, any place that you want to take your horse. And fortunately, they make readily made vaccinations. And these vaccinations help to protect our horses against things such as strangles. Well, one of the most contagious diseases is strangles, and once it is introduced, it is hard to eradicate. It's very hard to eradicate, and once it gets in the soil, it usually stays in there. So steps must be taken to isolate the infected, and then, worst of all, seemingly healthy horses can be carriers. So horses that are infected will carry this. They can carry it. So what is strangles? Like I said, it's Streptococcus equi, and it's an upper respiratory infection in horses. And as you can see in the picture, it is not pretty, and it has these little pus-like, they look like blisters that have to be popped in their throat area near those glands. Symptoms of strangles would be fever and upper respiratory tract catarrh, which are inflammation of mucous membranes in one of the airways or cavities of the body. We also have acute swelling and subsequent abscesses formation in submaxillary, submandibular, and retropharyngeal lymph nodes. And it can become fatal if not treated properly because these airways can become restricted and horses can get infection. So there's treatment for strangles, fortunately. The abscesses need to be drained and completely cleansed and dried, and these signs become visible 7 to 12 days after exposure. And doses of penicillin are the main treatment to fight off infection, and you must take extreme measures to disinfect your barn for prevention. You might want to have a bucket of bleach handy for people that are coming into your barn to step into and out of as they leave also. Fences will need to be disinfected. Anything that other horses come into contact with that could possibly spread strangles. So there is a possibility of healthy carriers, and infected horses can carry the virus for longer than the symptoms persist. So those horses technically get over strangles, but then they carry it and you don't see it. And they are called asymptomatic carriers, and they can be very dangerous because they can infect other horses still. And the reason that they can do this is because they have incomplete drainage of exudate. The exudate dries and hardens to form discrete bodies called chondroids. And in the picture, this little white area you can see is a chondroid right here, and that is what's left over from the strangles from the previous infection. These chondroids can remain in the guttural pouch for several years. Fortunately, there is a way to detect for chondroids, and they use PCR, which is polymerase chain reaction. You can also get a culture of S. equi, and this is a common way of diagnosing strangles. As stated by Newton in 2000, use of repeated nasopharyngeal swabbing and culture of S. equus show that healthy carriers developed in more than 50% of strangles outbreaks. So this shows that the chondroids are actually being developed in a lot of these horses that have been infected. And the only way to detect these healthy carriers is by looking into their guttural pouches. Sometimes not even swabs and cultures could detect the carrying of chondroids, so they started using endoscopy to develop a PCR test that could detect for these chondroids. So why this is important? Strangles is very contagious, and all measures should be taken to keep strangles out of your barn. If you think that your horse might have strangles, then you should definitely tell your veterinarian right away and put it into isolation as well. Because whether your horse has strangles or not, it is best to take the most extreme measures so as not to spread it. Because, as stated before, once it's there, it is so hard to get rid of. So ways to prevent the spread of strangles: you have your vaccination, And then cleanliness. So the bleach in the buckets, cleaning all the walls, cleaning all the hard surfaces in a barn, and keeping horses that may be infected away from each other and away from the other healthy horses in the barn. And also, people that are around these horses with strangles, you'll want to make sure that your clothes are clean and that you don't visit another barn unless you have clothes on that have not been in contact with these horses that have strangles. And you also want to be able to detect chondroids in healthy carriers. So, as mentioned with PCR and cultures, you want to be sure that these horses that have been infected with strangles are no longer carrying the disease. And that is it.